In his interviews with the European press, Mr. Trump said NATO is obsolete because this is the age of terrorism. Mr. Trump did not mention NATO's 15 years of fighting al-Qaeda in Afghanistan. The president-elect told the Washington Post that he is nearly finished with his plan to replace Obamacare. He promised health insurance for everyone, but with no details. Many Americans are worried. Here's Mireya Villarreal.
Do I pay for this medication?
As a child, Barbi Appelquist survived liver cancer, but as an adult, insurance companies could reject her based on a pre-existing condition. She says she spent most of her 20s with basic insurance that covered almost nothing.
I remember refusing tests because I was afraid I couldn't pay for it.
In 2010, the Affordable Care Act enabled Appelquist to find a private insurance that covered her pre-existing condition. 1 year later, she was diagnosed with soft tissue sarcoma.
I was scared. I was really scared.
Were you at all worried, knowing the insurance that you had?
No. I wasn't worried that I could not receive the care that I needed. All that mattered was that I was at a place where the doctors knew what to do, and I would be okay, and my family would be okay.
Our goal is a truly patient-centered system.
Congress took the first step to repealing Obamacare last week. Over the weekend, opponents staged rallies from California to New Jersey, Oregon to Maine. President-elect Trump, who campaigned strongly against Obamacare,
it'll be repeal and replace,
told the Washington Post he's near completing a plan to replace it with the goal of insurance for everybody.
Hey, there you go.
Appelquist pays about $15,000 a year for coverage. She estimates her basic care without it would cost upwards of $150,000. When you hear those promises, are you hopeful?
Without something in place regarding who's going to pay for it, it's hard to put my hope in that plan.
President-elect Trump says he will unveil his plan once the Senate confirms his choice for Health and Human Services Secretary. Scott, he also says he's going to take a hard look at the prices that drug companies are charging Medicare and Medicaid.
Mireya Villarreal in our Los Angeles newsroom.